Hi there, my name's Dr. Sonal, and these are my opinions only, not of the institution I work for, not related to the medical community of which I'm a part of, but just my opinions. Thank you. Hello there. So you've decided to call your physician, you're worried about symptoms, and they've talked to you a little bit about testing. Make sure that you do call your physician, call your MD, because they'll know where to get testing done that's local. There are some areas that have drive-through testing done, so you can limit your potential risk of exposure even while you're there. Otherwise, going to a walk-in clinic can actually introduce you to the virus itself, because people who are seeking out a test are going there as well. When people need to get a test done, right now, at least in Tennessee, we have an RNA test that's available, but it's about 68% sensitive, which means that if you are truly positive with the disease, there's a 68% chance that the test will be positive. And so the problem is that's not 100%, and so there are people that could be getting missed. And so if your story is good, your symptoms are concerning, and your exposure risk is real, then the reason you want to call your physician or call your MD is because they may go ahead and treat you despite the results of the test, or if your symptoms are mild, which is about 80% of people, if they're moderate, which can involve hospitalization, which is about 15% of people, or if it's severe, which is about 5% that involve a ventilator, then these patients are going to be treated differently as far as their treatment plans. Mostly it's going to be supportive if you have mild disease and you'll need to be quarantined at home, and all that stuff can be done with a virtual visit with your physician through telehealth medicine. And so if you're not sure, call your physician. If you need testing, call your physician. If you have any question, just make sure that you call your MD, because that is the most important thing to do right now. The testing that's available right now, we talked about, is the RNA that we're checking for, but eventually they're going to have, hopefully coming out very soon, later in April or early May, an antibody test. And what antibody means is, if this is the virus, and this is what the virus looks like, when it gets exposed inside your body's immune system creates an antibody. And so it creates an antibody to attack this virus, and they usually have a nice close fit, an exact match. And so when we create vaccines, we inject dead pieces of the disease, like the virus or bacteria or whatever, and your body creates an antibody to that dead piece of potential pathogen or potential disease to create an antibody response. So when people have been exposed to live coronavirus and they get this exposure, then if they've cleared it successfully from their system and they have gotten it out of their body, then usually those patients are going to have antibodies that have been made, and either IgMs that are right at that moment mean they have disease, or IgG antibodies, which means that they've ever had exposure in the past. So if you have these antibodies that are present, that means that your body's immune system has already successfully likely defeated this, and it's hopefully out of your system, and these antibodies will be remaining. So that's why people are talking about these plasma treatments, because people who've already had past disease have these antibodies circulating, which can hopefully attack the virus that's there, and so potentially can be used as a treatment. But also, if we have a rapid antibody test, so we can look for past exposures, or if we have a rapid RNA test where we can actually look for the virus, then we'll be able to better see and tell who's had disease, who's at risk for disease, who's actively shedding and spreading virus potentially. So once we have these kinds of things in place, which will hopefully happen over the next 2 to 4 weeks, then we can more safely tell who can go out. But also, if we can tell right immediately with like a 15-minute test who's having disease present, then we can have them be tested. We can trace back to their potential exposures in their family or household or community that they've been hanging out with, and hopefully that's a very small list of people if we're all socially distancing or physically distancing. And then we can isolate all of those people and ask them to self-quarantine at home. And so what I'm going to do is I'm going to talk about now, in the next video, I will talk about what to do if you've been diagnosed as positive, or what to do if you've been told by your physician to presume you're positive, what we call presumptive positives, that we're not testing because their symptoms are too mild, but we're going to go ahead and treat them like they had the disease and have them isolate at home. Thank you.